All right, on your screen, you see a few things that we're going to go over today. The open enrollment benefit choices with United Healthcare. You have 3 plans to choose from. Your dental plan, vision plan are all with United Healthcare. Then you have some exciting benefits, employer paid benefits and voluntary benefits with Unum. We also have some Aflac products that you have available. Those are 100% voluntary plans. We'll open it up for questions towards the end, and we'll talk about due dates for enrollment forms and changes. The open enrollment starts now, or today, I should say, and we would like everything submitted, any changes by June 17th in order for us to process, communicate to United Healthcare, and have everybody new ID card delivered to them by July 1st. So if you have any questions in regards to your benefit elections, please contact Vanessa or myself before the due date so we can address those concerns and get those enrollment forms over to United Healthcare. Additionally, as I stated earlier, these benefits are effective July 1st and will run until December 31st, 2019. So it has come to a decision, the company has come to a decision to make all of your benefits run concurrently with your deductible. So currently, the medical deductible begins January 1st to December 31st. Your plan begins July 1st to June. So it doesn't match, it doesn't run concurrently. So in October, we'll review plans that UHC will provide, and the company will make a decision on which plans will be offered effective January 1st, 2020, and those will run until December 31st, 2020. So more exciting news to come as we approach October. Does anybody have any questions in regard to that?
No questions in the room. Thanks, Leticia.
Okay. Oops, I think I went too far. So we're going to go over eligibility. Everybody that works 30+ hours is eligible for benefits. Additionally, legal spouse, domestic partners, children up to the age of 26. As I stated before, these benefits will begin July 1st. So once you make your election, you're locked in until the end of the year. If you need to make a change in your benefits, you can only do so if you have a qualifying event. Qualifying event being marriage, divorce, legal separation, birth, or adoption of a child, change in benefits. For example, if your spouse is currently covered under a different plan and his or her open enrollment comes up and the benefits are more expensive or better, that opens it up for you. So from the date of the event, you have 31 days to communicate with your HR team here at CVR that you would like to review your benefits. So it's very important that you keep that 31 day in mind. If you exceed the 31 days from the date of the event, you do have to wait till the next open enrollment period, which we know now will be at the end of this year. Next, we're going to go over the medical plans. For simplification reasons, we've changed the name of the plans to options 1, 2, and 3. Some of these benefits are the same that as you know them. Other ones have changed. So we're going to go over option 1. So United Healthcare option 1. Previously, this was a $1,000 deductible. United Healthcare has changed that plan, and this is a plan that's now available. Deductible is $1,500 for an individual, $3,000 for the family. And the only time you're going to pay your deductible is when you have major medical services, such as surgery, birth of a child, things of that nature. That's when you're going to start paying towards your deductible. Once you meet your deductible, then the co-insurance kicks in, which means the cost share between you and United Healthcare. So that is 80-20, UHC picking up 80% of the cost, and you, the member, pay 20% of the cost till you reach that out-of-pocket maximum. So the out-of-pocket maximum is your safety net, worst case scenario. In a year, surgeries, therapies, out-of-pocket expenses all go towards that out-of-pocket maximum. If once you meet that, as I said before, as an individual or as a family, you are into 100% coverage as long as you stay within the network and in a calendar year. Okay. Maximum lifetime, all the plans have an unlimited lifetime maximum, which means the insurance company will never stop paying your benefits. Before, it used to be a maximum 1 to 2 million, depending on the insurance carrier. That all went away. And all of the plans, and this is very important, have preventative care, which means you can schedule your annual exams at no cost. Now, under healthcare reform, and also in some states it varies as well, we're entitled to 63 wellness exams depending on age and gender. So the children, we know, get their shots. There's the well woman, well man check. Make sure you schedule those preventative exams with your doctor. On this plan, should you need a sick visit, it's $25, and a specialist is $50. You don't need a referral from your primary care physician. You can self-refer. Your urgent care on this plan is a $25 copay, and the emergency room is $250 per occurrence. Deductible price applies prior to the overall deductible. So what that means is that you're going to be paying towards your deductible in the emergency room. We try and stay out of the emergency room unless it's loss of life or limb. You have other options such as telemedicine, urgent care. So I would look at those options before. Obviously, if it's serious, then you need to get to the emergency room as soon as possible. You also have prescription copay. This is true for all your plans. That $10 generic, preferred is $40, branded is $75. And you have mail order at 2 times the retail copay on this particular plan. So for your specialty medication on this particular plan, you will be paying the retail cost of that medicine. Any questions on option 1? Okay. Your next plan is option 2. It's a $250 deductible for an individual, $500 for the family. You also have that co-insurance at $90.10. And your out-of-pocket maximum is $3,500 for an individual and $7,000 for the family. Again, you only need to worry about those items if you have surgeries and things of that nature. Your co-pays for your primary care are $10, your specialist $20. Your urgent care is a $10 copay. Your emergency room is going to be subject to your deductible, which is only $250 for an individual, $500 for the family. So that's why it's deductible than 90%. And your prescription's a little bit different here. It's still a $31 retail. And the copays apply after $100 deductible for your prescriptions. Okay, $15 again generic, preferred brand name $25, brand name is $50, and again specialty is going to be retail cost of the medication. Any questions on the 2 plans?
Yes, we have a question in the room.
Go ahead.
Yeah, on the emergency room, the deductible is then 90%. Does that mean insurance covers 90% and we have to pay the remaining 10?
Correct.
Yeah.
Got it. That's
okay.
Exactly how it works. UHC will always pick up the higher percentage.
So for a contrast, for option 1, after I pay my $250 deductible, what will UHC pay for the emergency room costs after I pay that $250?
80% of the cost.
Right. Okay, thank you.
20%. You're welcome.
Yep.
Okay, now we're going to plan 3, option 3. So today you have a 0 deductible plan with a lower out-of-pocket maximum. The increase to this plan that United Healthcare was offering was too high. The company made a decision to offer a similar 0 deductible plan with a little bit higher out-of-pocket maximum. You still have some of the same great benefits. It's just less expensive for the company and less expensive for the members. So again, 0 deductible for this plan. You do have the co-insurance at 80/20. Your out-of-pocket maximum is $7,900 for an individual, $15,800 for a family. Again, the only time you're going to have to pay towards this is if you have major services in a calendar year. Maximum, again, unlimited. Preventative care is covered at 100%. Your office visits are $30 for your physician, $60 for your specialist and $25 for your urgent care. $100 emergency room per occurrence deductible applies. Obviously, there is no deductible here, so you'll start to pay towards your out-of-pocket maximum in the event that you are hospitalized. If you just go in for the service and you're released the same day, you'll pay your $100. Okay. This one, prescription's a little bit different. You do have a 31-day retail supply, $10 for your generic. Your preferred is $50. Your brand name is $100. Your specialty is $150 copay, and you still have the ability to do your 90-day mail order for 2 copays. So there's some savings there. So additional benefits, child and dental vision exams are covered by all of the plans. You have also telemedicine available and nurse on call. So you should all receive a guide that has additional information. If you need additional information on these services, I can send them to you via Vanessa, so you can take advantage of these services. Any questions? Okay, those are the major changes for your medical. Next, we're going to go over some of the items that have been effective since January 1, mostly reminders, and then we'll go over your dental and your vision plan.
Hey, Leticia, can I just interject one quick thing here?
Of course.
I think it's implied, but just to make it explicit, that for the medical coverage, we are still in an age-rated plan. So the reason we haven't put the premium cost to you on this presentation is because it varies based on your age. So I will be working with Leticia to put together a spreadsheet that will have the information that you will need to know how much each of these 3 plans would cost you in a premium cost based on your age and the age of any other family members that you would like to have signed up for the plan. So I would really love to get that out to you like today or tomorrow. So Leticia, I just need to talk to you about getting those rates in one spreadsheet, but because I know that you'll need that information in order to really evaluate what's best for you and whether you want to make a change here.
Yes, so Lauren here in our office, who is your HR contact here at CVR, also has all the rates of her age. So she has those available now in a spreadsheet, and we can send those out later today, and we'll label them options 1, 2, and 3, and give you some instructions on how to calculate the premiums. It's pretty self-explanatory, but if there's children involved, things of that nature, we want to make sure we get everything over to everybody so they can make a decision, since we do have a tight timeline to get everybody enrollment cards by July 1st.
That'd be great. Thank you.
No problem. Next, we're going to go over some of the items. For example, the flexible spending account. Everybody should have received information earlier late part of 2018, early part of 2019 in regards to the flexible spending account. This is just a reminder. This is another reason why the medical plans are being changed to calendar year, because everything runs calendar year. Your flexible spending accounts run calendar year, and in 2020, if there's a health savings account option, that will also be a calendar year. Your flexible, this is just a reminder, your flexible spending account medical has a maximum of $2,500. As a reminder, at the end of this year, if you have anything in excess of the $500, you will forfeit that amount. So keep in mind, if you have balances, to utilize them utilize anything in excess of $500 by December 31st, 2019, so you don't lose your money. You also have the dependent care flexible spending. Again, this is for children and elderly, children up to the age of 13. And the money is put into an account, and you utilize it as the money is put into that account. It's not front-loaded like your flexible spending account. So different types of accounts. Both of them have a pre-tax deduction, which lowers your taxable income, so it's definitely a benefit for everybody. Any questions on the flexible spending accounts?
No, can you hold on a second? Little technical difficulty here. My computer just went to sleep, so.
Okay, no worries.
Maybe, I guess the question would be whether it'd be helpful for you just to do your elevator speech, your two 3-sentence elevator speech on what is a flexible spending account and why should I think about using one, in case people are not familiar with those.
So flexible spending accounts, you have two types, a healthcare flexible spending account and a dependent care flexible spending account. So these two types of account allow you to put aside pre-tax dollars to spend throughout the year for medical expenses, medical co-pays, prescriptions, dental care, vision care. You can put up to $2,500 aside at the beginning of the year, and everybody will receive a notice later this year. And you can use that in January. So that Visa card that you see on the screen is loaded with whatever amount you elected, ready to utilize for any services that you need. Again, this plan, the flexible spending account, has a $500 maximum carry over into the 2020 plan year. So, you know, keep that in mind when you make your elections throughout the year. So the deductions or the selection that you make is pre-tax, deducted from your check pre-tax, which the benefit to you, in addition to having that money front-loaded, it lowers your taxable income. So you can get less taxes and more taken out and more money in your pocket. It's definitely a really good benefit. The same applies to the dependent care.
Sorry, go ahead.
The same applies to the dependent care, again, pre-tax dollars, so lowering your taxable income, more money in your pocket. This money is put into an account as it comes out of your check to utilize to either pay yourself back, pay your daycare provider, or elderly care. It also helps really good with budgeting purposes. I use one for my daughter. It helps me allocate funds going towards my daycare. So I know exactly for the entire 12 months how much I'm going to use and how much I'm going to spend on that service. And again, it's you know, pre-tax, so it lowers my taxable income. So the government taxes or takes less money, if you will, out of my paycheck per pay period. So those are the benefits. Just, you know, later down the road in 2020, if the high deductible health plan tied to an HSA is appealing, we'll definitely be offering that. That's another tax saving vehicle. It's actually a triple tax saving vehicle. And it's exciting, you know, if the company is able to offer that, because it allows you to put away some dollars for medical expenses and our future self. So we'll definitely start communicating those things later this year.
Thank you.
You're welcome. So your dental plan with UHC, no changes to the plan itself. It's still.
Oops, sorry, we had another question in the room. Sorry.
Yeah, I just had a quick question about the flexible spending plan. I know we were issued a credit card. You can either make a claim separately through the web portal, or you can use the credit card. Isn't that correct?
That is correct. Lauren, are you on the phone? Are you able to speak to that a little bit more?
Maybe she's muted. I think she's on the phone. I see her name, LD.
Yeah, she is on the phone. So there's a couple of ways you can either, oh, she said she's muted. Let me unmute her.
Yeah.
Okay.
Lauren, are you there?
She was.
Did we lose you both?
I'm here. Can you hear me?
I can hear you. I can't hear Lauren, though.
So I said all, so she should be able to. It's her. She said she's not able to unmute herself. So I know that you can do it a couple of ways. You can submit the claim either, you can download the app to your phone. So there's a task app that you can download. Download to your phone, and you can take pictures of receipts and upload them should task ask for them. You can also go to the portal, upload receipts, and request to be paid back if you pay cash, or you can use your card and swipe. Lauren is actually coming into the office, so she'll be able to speak to it a little bit more. The question is the options to submit your expenses to a task.
Hi everyone, this is Lauren. I apologize for the technical difficulties. So if you have a submission for task with your FSA, if you don't have your FSA card or your FSA card isn't accepted, you're going to want to make sure you enroll on the portal, submit the receipt, and submit the documentation, and that will be all you need to do. And
awesome. Thank you, ladies.
Yeah, you can also use the mobile app for that. You're welcome.
Okay.
All right, next we'll move to the dental plan. So there was an increase to the dental plan as well. We'll send over those rates. Those, of course, are all the same regardless of age. It's just depending on how you are enrolled, Employee Plus. So the same benefits you have today with the dental plan. It's a PPO plan, which means you have a set dollar amount to utilize towards your services. So in this particular plan, your preventative services are covered at 100%. Your basic services, such as a cavity, is an 80% cost share. So the member pays 20% and UHC picks up 80%. And this is where your deductible will kick in. So as an individual, you have a $50 deductible, and as a family, a $150 deductible, and you pay that once per calendar year. Major services is a 50% cost share between you and United Healthcare. Again, if you have not paid that deductible, you'll be subject to that deductible at that time. And there is a 12-month waiting period for major services. So if you have not had dental coverage in the past and you're enrolling for the first time, you will have a waiting period for those major services. But if you had previous dental coverage or you're currently enrolled in United Healthcare, you won't be subject to that waiting period. Your annual maximum for this plan is $1,000 per person enrolled. Now, this plan does offer the same in and out of network benefits. The difference with out of network is you will be subject to balance billing from the provider, which means they will accept whatever United Healthcare pays them, but they will send you a bill for the difference. Any questions on the dental? Okay. Your vision plan stayed the same and no cost increase to the vision, and the benefits are exactly the same with United Healthcare. So your exam is a $10 copay, and that's available every 12 months to the date. If anybody has gone to get their vision exam, they really do stick to that 12-month rolling period. So another reason why you want to change this to calendar year. Frames, every 12 months, $130 allowance, then you get a discount above that. Your lenses, every 12 months, is a $25 copay, single vision, bifocal, and trifocal. Your contact lenses for disposables or conventional, you get up to 4 boxes, included with 105 benefits. And then if you need medically prescribed contact lenses, they're covered in full, so there's no out-of-pocket expense there. You do have an out-of-network benefit with the vision plan. How that works is you pay the cost up front, and then you submit a claim form to United Healthcare. Any questions? Okay. Next are the employer-paid benefits. So Empower does pay for benefits for everybody. Life insurance, 1 times your annual salary of $250,000. Short-term disability and long-term disability are both paid by the company and cover all of the eligible employees. Additionally, if you would like to purchase life insurance above and beyond what the company offers, you have the ability to do so with Unum. And it is 5 times annual earnings up to $500,000. $200,000 of that being guaranteed issue if you're enrolling for the first time because you're newly eligible. For spouse, it's $25,000 guarantee issue, and for children, it's $10,000 guarantee issue. Okay. Any questions on the life insurance or disability?
Nope.
Now, keep in mind, for those of you, all the employees that are covered under the company's life insurance policy, if you have a qualifying event, such as a divorce or marriage, you may want to update your beneficiary form. You can do that at any time, even if you don't have a qualified event. Is Maryland a community property state, Vanessa?
I'm not sure, actually.
Yes.
Okay.
Yes.
Okay.
Okay, so we have a yes in the room. So being said, Arizona is a community property state where I sit, so your spouse is automatically your beneficiary. Keep that in mind when you're selecting your life insurance and when you're updating your beneficiary form for the company paid life insurance.
In the event you don't want it to be your spouse, you must take action.
Wife, which is not updated.
There is an affidavit that needs to be completed per state and submitted with the enrollment form if you don't make your legal spouse your beneficiary. That I do know with UNUM, so they just require that form. But again, anytime you want to change outside of your legal spouse, your beneficiary, your brother that you don't talk to anymore, get him off, or whatever the situation is, just make sure you notify us so we can get you the form that's needed right away. Okay, any questions on life or disability?
No, I don't think so.
Awesome. All right, with that said, we have some exciting benefits to offer from AFLAC. Do we have Jose on the phone?
Yes, can you hear me?
Yes.
Can you hear me? Sorry, no,
Yes.
I was trying to unmute myself. I got the audio on, but I didn't want to create the feedback. So, hello everybody. My name is Jose, and thank you, Leticia. And I'm gonna go quickly over the AFLAC voluntary. So, at any point, if any of you had AFLAC or saw a presentation, we're excited to partner up with CBR and introduce some of our voluntary plans, meaning that you are the policyholder. On a voluntary basis, you get to pick and choose whichever one of these plans fits you and your family needs. So all of our plans are voluntary. It protects you and your family members up to the age of 26. You pick the coverage that, if you feel maybe an accident is the most popular one because you've seen all the commercials with the quacking duck. Somebody can get injured on and off the job, probably, driving home, working out, and doing any kind of, sports, or the kids playing sports after school. So whether it's a small cut, bruise, laceration, you have to go to urgent care, anything that you seek medical attention for, the accident plan is going to help out. And if it's a serious injury, they'll pay the first hospitalization benefit of $1,000 the first night. That goes towards probably offsetting some of the out-of-pocket for the copay, co-insurance, maybe your deductible. So AFLAC is a unique offering because they're fully portable products, and you own the plan from day one, but it is a payroll deduction. So all of your, deductions will look the same. If there's any changes, AFLAC goes with you, the portability kicks in, and technically you keep the same coverage for a lifetime. We talked a little bit about short-term disability from UNUM, but AFLAC also has a voluntary short-term disability that pays a separate benefit. We don't coordinate, so if you pick one or the other, we'll have that discussion. But if you're interested in a short-term that protects, same thing, 3 months or 6 months, it's a guaranteed issue plan. There is an option on that one, but that's only to protect your personal paycheck. Does not protect mom or the kids. It's just individual for you. We have the hospital confinement, and if at any point you get sick or injured and are admitted to a hospital, an actual admission to a hospital bed, the first 23 hours or more, AFLAC is going to pay you either $1,000 or $2,000. And this is our unique offering because it's designed with the ACA, the Affordable Care Act, that if you have a high deductible and maybe you have a health savings account, or you go with one of the low, with the high deductible options, that you have additional funds coming in right after the event takes place. AFLAC's claims process is about 48 hours from when you submit it, and about 4 days is direct deposit directly to your personal account. We have a portal that you can select that, but this hospitalization is sickness or injury. So the accident has an injury-only benefit. If you happen to have both of these plans, the accident will kick in, pay you the first $1,000. If you go with the $1,000 level with the hospital, they both are going to pay out, and now you have a $2,000 benefit coming in. If it's family planning, maybe you're looking to trying to have a baby coming up in the next year or so, the effective plan is 7/1. If the childbirth occurs after 10 months from the effective date, AFLAC will pay the benefits. the newborn child will automatically be covered within the first 30 days. If there's a NICU, heaven forbid, something more serious, the policyholder and the family members become immediately a patient for the hospital. After we'll pay out the benefit on both of them. There's surgical benefits you can go up to. If it's more serious, we have different levels that you can customize your own product. And then the last one we have here is the cancer-specific specified disease. And this is what most people that go through a health event, initial diagnosis, plus any additional treatment, whether it's chemo, radiation. This plan usually pays between $18,000 up to $35,000 when the first, initial treatment plus ongoing treatments. This one has a little bit of underwriting questions on it. It's not a guaranteed issue option. So if you've had cancer previously, you must be cancer-free for 5 years or more. But it is the one that most people don't talk about. Aflac pioneered the cancer protection plan in the U.S. actually. So those are our most popular plans. We do a pretty good job as far as supplementing the medical that Leticia's giving you all the highlights on. If you have any particular questions, my contact information is going to be on the, I think it's going to be in the packet or it's going to be on the presentation. Please feel free to call me, shoot me a quick email, and what I'll do is I'll coordinate a specific time that works with you so that you can do it after hours, maybe you're at home, and I'll send you individual customized rates so that you can see the rates are about $6 to $12 on a weekly basis. So most of you probably will be very excited to see that it's not a very high cost, but you get a lot of value and benefits from it. So, Leticia, do I have any other slides on this side?
That's it. Thank you, Jose. So I will send out additional information in regards to Aflac and Jose's contact information if you don't have it. And you can reach out to him directly and he'll be happy to go over, because they are very specific and very customized plans. I just also wanted to let you know that if you have a telemedicine event and you use a telemedicine through AUHC, that serves as an incident, and that could be what you utilize to submit a claim for an accident or things of that nature, laceration, something minor that you don't need stitches for. Obviously, if you go to the urgent care emergency room, there's your proof there, but you can also use telemedicine proof to submit to Aflac. So really good benefits. Keep those in mind. If there's additional information that you need, Vanessa, or the group wants to see, please reach out to me. I will send what I have, and then everybody individually can contact Jose and his team.
Yeah, thanks. I think that information is going to be important because I don't have any addition, other than this slide, I don't have any information on Aflac at the moment. So this must be a new thing that came up, which is great, but reminding you that we have a week for people to be able to take a look at that. So yeah.
So for the Aflac products, we'd have just a little bit more time because he will coordinate with our payroll team and get that done. It's just getting the United Healthcare changes over to them, so everybody has an ID card come July 1. Especially if you're changing plans due to cost or enrolling for the first time, enrolling family, we need everybody to have those ID cards as soon as possible. So we have a little bit more time and flexibility, but I will email you, Vanessa, Jose's information and the information, so everybody will have that.
Okay, thank you.
You're welcome. And then the next slide is what's next. So if you're making any changes to your current medical, once everybody gets the rates for all three plans, and you decide that you're going to stay where you are, that's perfect. If you're changing plans or enrolling anybody, a spouse or children are coming off, etc., we need those forms back to us by the 17th and no later. And I believe everybody should have a UHC enrollment form. Do you have that, Vanessa?
No.
Okay, so I'll make sure to send that over to you. There's information on the very last bullet point there that is not does not apply because we're not doing an HSA this time around. So I apologize for that error. So I'll get the UHC enrollment form out to Vanessa, all of the rates out this afternoon, and then a timeline with changes and anything that needs to happen, and then Jose's information and the Aflac benefits.
Okay, yeah. And just to re-emphasize bullet point 2 on here, for those of you that are currently in the zero deductible plan, which was previously known as the Platinum plan, that plan that we are currently enrolled in, because I'm in that plan, is going away. And so it's not porting over to another, it's changing to a completely different level. And so the closest plan to that one is Plan 3 that we've reviewed in this presentation today, because it does have a zero deductible option in network. But I specifically want to invite the people who are currently in the Platinum plan to take a close look at what the options are, and I'm happy to talk with you more about that, because I think that's the plan that's experiencing the most change in terms of the benefits, okay? Yeah.
Yeah, in terms of the benefit and the cost, it was the highest increase from United Healthcare. So I'll send that information over as soon as we get off the phone today. Additionally, I will send over the recorded presentation for anybody that was not able to make the call or wants to review additional information.
And just because it came up in the room and people on the call might have that question as well, like Leticia said, the health savings account on here should have, pretend you're not reading that right now, because we do not have a high deductible plan currently. So in order to have an HSA plan, you have to couple that with what's known as a high deductible health plan, an HDHP. And we do not currently offer in our 3 choices a plan that would qualify as a high deductible health plan. It is something that we'll look at together with CBR for January 1st. So between now and the end of December, that will not be an option. It is something that I want to look at come January 1st, because it may be a good option going forward.
Correct, and I apologize for having that on there. It is good to start to talk about it and think about it. And if it's something where the company is going, then we'll provide additional information, guidance, and education videos. We have so much information around it because a lot of our clients groups are moving towards high deductible health plans for many reasons. It's usually lower premiums for the employee and employer, and additionally that triple tax savings, and it allows you to save money for your future self for medical expenses. So really good things coming with that too. And the IRS has increased the limits or the maximums for 2020. So it allows you to put away additional dollars to save. So with that said, I would like to open it up if anybody has any additional questions that they haven't asked throughout the presentation in regards to any of the benefits that we touched on today.
There's none here in the room. Any questions from those of you who have called in today? Speak now. I will certainly be available to everyone throughout this week for questions as you dig into this a little bit. Keep an eye out for the rates, as Leticia said, coming out to you. And particularly for those of you that are remote, if you have any follow-up questions or you want some time with me, feel free to schedule something on my schedule. I'm happy to take a look at this with you. Even for those of us that look at this information on a more regular basis, it can be a little confusing. So I'm here as a resource to you this year, so please reach out with any questions that you have.
All right, thank you. And as Vanessa stated, look for those emails coming with the rates, additional information on AFLAC, and the enrollment form.
Excellent. Thank you.
Thank you, everybody.
Bye-bye.